Hello there, good day everyone, and welcome to Nursing with Delight. On our channel today, we're going to talk about fever. We're going to explore the definition of fever, the causes of fever, the pathophysiology of fever, as well as the medical and nursing management of fever. So without further ado, let's get right into it. Now, you'd agree with me if I say the word fever is not new, it's a familiar term. In fact, it's used all over the world. With that being said, I would like to highlight that even here in Nigeria, our parents, our grandparents, our ancestors, even the gods of our land, so to speak, has really misused the word fever. In that, if there's anything wrong with you in Nigeria, the first and probably only thing they will tell you is that you have a fever and you have to go and get drugs to treat your fever. But then, there is something I would like to highlight and correct. The word fever is often used in a wrong context, in the sense that it's used in a context as though fever is a disease condition or a disease entity. I want to highlight and correct the notion that fever is not a disease entity on its own or by itself, but rather it's often a symptom or a sign of a disease entity. So, with that being said, how can we define fever? Let's go to the definition. Simply put, fever can be said to be an increase in body temperature, often above 37.2 degrees Celsius. And if you convert that value in Fahrenheit, it will give us 98.96 degree Fahrenheit. Now, I want us to take a closer look at this definition because I want us to highlight three things that we're going to talk about. Now, the first thing you must notice is that the measurement of the temperature are expressed either in degrees Celsius or in degree Fahrenheit. So that is to say that temperature can be measured either using degrees Celsius or degree Fahrenheit. Although in this part of the world, Nigeria, is often measured or expressed in degree Celsius. However, during as this video unfolds, I will teach you how to convert from degree Celsius to degree Fahrenheit and from degree Fahrenheit to degree Celsius, or vice versa. Another thing I think we must note, right, is the word temperature. There is not talking about fever without talking about temperature. So let's talk briefly about temperature, right? Yeah, let's do that. Now, what is temperature? Right at the top of my head, I remember my primary school definition of temperature. Temperature is the degree of hotness and coldness of the body, right? How hot your body is or how cold your body is. However, you notice that most times, with the exception of you being sick, your body temperature is usually in a normal state, if I can use that word, right? It's not too hot, neither is it too cold, right? It's maintained in a homeostatic state, so to speak. And how is that possible? Now, despite that, when we have a variation in our body temperature, either we are hot or we're cold, we tend to feel it in our skin. The truth is, the temperature of the body is actually regulated up here. Yes, you heard me right. Regulated in your brain. So the part of the brain responsible for the regulation of temperature is the hypothalamus. Now the hypothalamus detects even minute shifts in temperature and sends signal throughout the body so that it can regulate it, bringing it back to normal. Now, the anterior part of the hypothalamus, as well as the posterior part of the hypothalamus, is responsible for these processes. The anterior part of the hypothalamus is responsible for heat loss, like when you're feeling hot and then the body has to give up heat so that it can bring the body back to its almost static state. Or the posterior part of the hypothalamus works for conservation of heat whenever you are feeling extreme cold, so that your body temperature returns to normal and then the body processes can function very well. Now, how does the hypothalamus achieve this? Now, just imagine yourself on a very hot day. You're hot, right? And you can feel it like, oh, I'm hot. So what it does is that the hypothalamus detects that, oh, my master, right, so to speak, body is hot. So what it does is that it ensures that the temperature returns to normal using two mechanisms. First, it sends signals to the sweat gland, causing the person to sweat. That's why you see that most times when you are hot, what do? You sweat. It's your body's way of ensuring that your body temperature returns to normal. So that's what mechanism is used to help promote its loss. Another thing it does is that it causes the blood vessels, right, to dilate. That is vasodilatation. And when the blood vessels dilate, as in it opens more than it usually does, if I can put it that way, it allows the blood vessels to go closer to the skin, thereby promoting its loss. Now let's reverse the scenario. What if when you are cold, you are in a very cold environment, how does your hypothalamus, the part of your brain, regulate your body temperature so that you can survive? Now it also does this using two mechanisms. First, it causes your body to shiver. That's why you see when you're in a cold environment, you are shivering, right? Now, by means of you shivering, your muscle is contracting, and your muscle contracting is promoting or generating it, thereby helping your body temperature to return to its normal days. Another mechanism the hypothalamus uses to ensure that your body temperature returns to normal range is that it causes vasoconstriction. So as opposed to its loss where there will be vasodilatation, your blood vessel is going to open, right? In trying to preserve it because you are cold, the hypothalamus causes your blood vessel to constrict, it causes it to become narrow. And by means of constricting the blood vessels, it generates and preserves it. That's where you don't get too cold or die from cold. I want to remember the whole essence of this is to ensure that your body remains in homeostasis with regards to your temperature. So we don't want too cold, no, we don't want that. Too hot, we don't want that either, right? So mechanism is put in place to ensure that as the hypothalamus is it's helping with its loss or its conservation, that it does not get too cold, neither does it get too hot, so much so that it exceeds 41 degrees Celsius, right? Because when the body temperature is up to 41 degrees Celsius, it puts the patient at risk of heat stroke or possibly potential organ damage. And trust me, we don't want that, right? Now let's go back to our topic for today, fever. Now, the causes of fever are categorized into two main causes, either infectious cause or non-infectious cause. Under infectious cause, we have things like the microbes, right, such as bacteria, virus, fungi, protozoa, as in malaria. Then for non-infectious cause, we have things such as conditions such as autoimmune disorders, we have malignancies such as lymphoma, we even have brain injury and certain medications. Those are categorized as causes of fever under non-infectious cause. But for the course of our video for today, we're going to be focusing on just the infectious cause. That is, we'll be focusing on microbes. How does microbes, so the presence of microbes in your body system, causes fever, and why does it cause a fever? Let's get right into that. So how does microbes, right, infection, how do they cause a fever to occur? Before I get into that, I believe that when anybody is experiencing fever, especially my mothers gather around, right? Whenever your child or anybody is experiencing fever, the first thing you want to do is to bring down the fever, right? Because we see fever as something really bad. Well, during the course of the lecture today, you find out that fever is more of the body's defense mechanism. In fact, it's protecting your body, so to speak. So let's go back right into what we're trying to explain. How does infection, right, the presence of bacteria, or virus, or fungi, or protozoa, or any microbes, how do they cause a fever to occur? Now, when there's a presence of a bacteria in the body, what it does is that your body senses that, oh, there's a foreigner here and we don't need foreigners, right? So your body releases, or your body soldiers come to the war front to want to fight that invader, the foreigner, right? Which is a foreign body. In this case, it could be a bacteria, a virus. Now, when it does this, the white blood cell releases what we know as cytokines, right? It releases cytokines. Now, these cytokines act as pyrogens. Pyro just means it, but pyro means it, gens means start, so, or begin. So they begin it, so to speak, so they start it. Also, now these cytokines released by the white blood cell in a bid to fight off the infection, that is a bacterial virus or whatever, or either of them, right? It's the cytokines then send signal to the hypothalamus, right? It sends signal to the hypothalamus that there is an invader. We have to increase the body temperature so that we can fight off this invader more effectively. How does it do this? Now, when the signal is sent to the hypothalamus, there is a chemical, right, in the hypothalamus, or a lipid compound that acts as a chemical messenger in the hypothalamus, right? So when the cytokines initiate or stimulate the hypothalamus and tells the hypothalamus, oh, there's an invader, we have to increase the body temperature. What it actually does is that there's a chemical messenger here known as prostaglandin, particularly PGE2, right? That the level is increased. Now, once the level of prostaglandin is increased, then the set point of the fever, right, or the set point of the temperature is then increased, thereby causing fever. And the question is why? Now, this is because on exposure of the body to an increased temperature, what it does is that some cells of the body will produce what we call HSPS. Yes, HSPS, which is an acronym for, or initialism rather, for heat shocking proteins. Heat shocking proteins. So when your body is exposed to an increased temperature, it causes some cells of the body to produce heat shocking proteins. These heat shocking proteins act as supporters to your soldiers, your white blood cell that is trying to fight off the infection. It's giving them water, it's giving them bullets to go and fight well in the war front, so to speak. How does it do this? This heat shocking protein, shortly known as HSPS, right? What it does is that it causes a particular type of white blood cell, the lymphocytes. It causes a change in characteristics, so to speak. It causes it to become very sticky. Now, when the lymphocyte becomes very sticky, it can adhere very well to the walls of the blood vessel and then passes it through with ease so that it can migrate to the area where the infection is raging. So, in a case of a viral infection, this heat shocking protein, HSPS, right, it tells nearby cells to reduce their protein production, which is essential for cell replication. And this action, therefore, stunts the spread of the virus infection as viruses need the replication of the cell, of its host cell, right, to reproduce. Another thing this HSPS does when it comes to viral infection is that it helps to protect surrounding cells. One way virus also acts or work in the body is that it causes cells to rupture. So when there's a large scale destruction, it can lead to potential organ damage. But then HSPS, right? When the body's temperature set point is increased, which means if there's presence of fever, right? This HSPS is released, and then it also protects the cells surrounding or surrounding cells, so that viruses will not cause rupture to the cell. So you see that fever is one of the body's innate mechanism to ensure that it protects your body from invaders, from infections, or from infection, thereby fighting infection effectively. Now, to understand this, I would like to give a graphical illustration. So, I hope you can see the board. So, this is like a graphical sheet, right? This is the measurement of temperature in Celsius and also in Fahrenheit accordingly. So see, this is what happens, right? Really. So when there's a presence of infection, the white blood cell detects that there's a presence of infection, and then it releases cytokines, which travels to the hypothalamus to tell the hypothalamus, okay, there's an infection, we want to fight. We need the immune body response, and so you have to set the temperature. You have to increase the set point of the temperature. So let's assume this was the set point of the temperature of the hypothalamus, right? So what it does is that immediately it receives that signal from the cytokines, it increases the set points. Let's say like this, right? It increases the set point like this. Now the body temperature now tries to catch up with the increased set point of the temperature that was set by the hypothalamus, of course. So the body temperature tries to catch up, although initially it lags behind, right? But then it tries to catch up, and then catches up, right? And your this at this set point, at this point already, the person will be experiencing fever, right? Your body will be hot, right? That's fever. And so it could stay like this for a few days. And when probably the body can detect that the white blood cell, which is the body soldier, is effectively fighting off the infection, then it reduces the set point reduces, right? And so when the set point falls to the baseline that is considered to be normal, let's assume 57.0 degrees Celsius, the body temperature also falls down. So it falls down, right, to the point, to the new set point, which at this point is considered normal. Let's assume it's 37.0 degree Celsius. And so your temperature is back to normal. So while the body is trying to increase, when there's a new set point increase and the body temperature is trying to like keep up, right? At this point, if you notice, there's a difference, right? There's a difference. So at this point, the hypothalamus new set points, And the body, since they're trying to keep up, is trying to tell the body, okay, you have to heat production or heat conservation must be made. And so it causes you to shiver, right? And that's why sometimes you might experience cold during the first few days of fever, and you might be experiencing fever. But then after a few days, and then the body knows that, oh, we have successfully fight the infection, right? It returns back to its baseline that is considered normal. Now, this after considering the actual cause of fever, you agree with me that fever is the body's response to an infection, right? To protect your body from infection, to protect my body from infection. So that's why on this note, some clinicians will not readily want to reduce body temperature. Clinical trials do not indicate if giving antipyretics, that is drugs to reduce fever, if it worsens symptoms or if it increases recovery rates. And so therefore, despite the fact that fever is understood to be like the body's mechanism to fight off infection, the decision for a clinician or a doctor to use antipyretics or not is left in their discretion. Although, of course, clinicians or physicians often consider things like the what's it called, the measurements of the temperature. If the temperature is very high, remember we said when your temperature is very high, like it's up to like 41 degrees Celsius or even 40 degrees Celsius, right? So pyresic, right? So it puts you at risk of organ damage or heat stroke. And so if clinician or a physician might want to give you antipyretics, but then that's left in their description. Now, what is the management of fever? What are the managements of fever? Management of fever can be grouped into medical management and nursing management. So what's the medical management for fever? Now, fever can be managed either using or giving antipyretics, right? Example of antipyretics we have paracetamol, also known as acetaminophen, right? You give paracetamol to reduce fever. If you remember what I was trying to explain earlier, I said for a fever to occur, usually in the hypothalamus, there's a lipid compound that acts as a chemical transmitter, okay, known as prostaglandin, that has to be increased first, right, before a fever sets in. So the mechanism of action for paracetamol is that it inhibits, right, or it blocks that increase of prostaglandin, mainly PGE2, thereby preventing or reducing fever. Now, another medical management for fever is by giving antibiotics. Remember, we said some of the causes of fever is infectious cause, which could be caused by microbes such as bacteria, fungi, virus. So, if the cause of fever is also as a result of a microbe, bacteria, giving antibiotics as well to kill off the bacteria will equally help, right, in managing fever. Then another thing that can use the doctor can equally give to manage fever is giving anti-inflammatory, right? For one of the non-infectious cause, we mentioned autoimmune disorder, right, which could cause inflammations in the body. So by giving anti-inflammatories such as aspirin or ibuprofen that helps to reduce inflammation, it can therefore help to properly manage fever. Now let's talk about the nursing management. What's the nursing management for fever? Now, one of the things we focus is heat loss. And how do we do this? You can give a patient water to drink. That way, it can be lost through convection and conduction. Another thing you could do is to expose the patient's body. If the patient is not too cold, you can turn on the fan. That way, it can be lost through evaporation. Or also, you could septic sponge the patient, getting a clean water and a clean cloth, dip the cloth inside the water, and then squeeze quite reasonably, allowing a little bit of water to still remain within the cloth, right? And then use to clean the patient's body. As you clean, you want to leave like films of water. That way, its loss can equally be promoted through conduction because there's a contact, right? Second thing we focus on as nurses is equally to encourage rest. And this is so because with every 1 degree Celsius increase in temperature, 12.5% energy is required. And if we should equate that, that's like equivalent to like some person's 20 minutes jogging. So you can imagine how tired the patient will be feeling. So one thing as nurses we want to prioritize is rest. Ensure that your patient is resting. The third thing we focus on as nurses is to promote hydration because when there's an increase in body temperature, it causes the patient at risk of dehydration and we don't want that. And when you promote hydration, so it also helps to keep the pulse rate within normal range. And let's go to the concluding part of our video for today. And that's how to convert from Celsius to Fahrenheit and from Fahrenheit to Celsius respectively, or vice versa. Converting from Celsius to Fahrenheit and from Fahrenheit to Celsius is quite simple. It's just like simple math. So this is how you do it, right? So let's assume that we're given a value of 37 degrees Celsius to convert to Fahrenheit. So what you have to do is that in brackets, the value given to you, you will times it with 9 over 5 in brackets, please. And then outside the brackets, you add 32 to it. Now, if you should do your math, you will get 98.6 degree Fahrenheit. Now, let's assume this same value is given to us to convert to Celsius. So if you are converting from Fahrenheit to Celsius, it's same values, but then the locations are kind of like interchanged. Okay, come with me. So for example, we're given 98.6 degree Fahrenheit, right, to convert to Celsius. All you have to do is you minus 32. So this 32 that is outside of the bracket, right, and then you're adding. And then this time it's inside the bracket and you're minusing 32. And then you are timesing with this value, but then it's now inverse, right, in the inverse form, times 5 over 9. So if you should do your math, you get 37 degrees Celsius. So this is how you convert from Celsius to Fahrenheit and from Fahrenheit to Celsius. Quite simple, right? Yeah. So clinically, temperature is measured either using core temperature or peripheral temperature. But core temperature is quite invasive, right? Because it involves using rectum, like rectally, or through urinary bladder or catheter, right? Or your pulmonary artery. Imagine someone doing that to take temperature. Wow. Well, that's how you measure core temperature, but it's quite invasive, and so most places in the world, right, they don't they resort to peripheral measurements of temperature as opposed to core temperature because patients tend to prefer peripheral temperature measurements. Now, peripheral temperature measurements includes like taking your temperature measurements orally or using your axilla, your armpits, or even your tympanic temperature and the likes of them, etc. Right? Now, the thing is that with core temperature and peripheral temperature, there's a bit of a difference. Now, for example, for core temperature, when it comes to oral temperature measurements, core temperature will always be increased with 0.6 degrees Celsius. So you should take note of that. So core temperature is always a bit more increased than peripheral temperature, often with 0.6 degree Celsius. Now, one thing I want to highlight too is that your temperature doesn't stay static, it doesn't stay in one place. It varies during the day. With you being the coldest or the coolest during the morning, like 5 a.m. thereabouts, and then being the hottest at about 3 p.m., 4 p.m., right? So temperature does not have a particular value that's considered normal, but then it's a range. So it ranges from 36.0 degrees Celsius to 37.2 degrees Celsius. That's one school of thought. Another school of thought might tell you 35.9 degrees Celsius to 37.2 degrees Celsius, right? But then anything below 35.9 degrees Celsius is considered hypothermic. The patient is too cool or too cold. And anything above 37.2 degrees Celsius, the patient is considered to be febrile. That means the patient, that means the patient is starting to have a fever. So that's all for fever today. Please feel free to engage with this post, ask your questions, feel free to comment on any topic you would like me to discuss in my next video. Thank you for watching. God bless you and have a blessed day. Bye.